Hello, I'm James Jackson, Chief Executive Officer of the Alameda Health System. In times of illness, uncertainty, and loss, hospitals are not just places of treatment. They become sacred spaces where patients, families, and staff face some of life's most vulnerable moments. This is why spiritual care and chaplains are so deeply important. They bring a compassionate presence that tends not only to physical well-being, but to the spiritual and the emotional needs that medicine alone cannot heal. To learn more about spiritual care and the role chaplains play here at the Alameda Health System, we spoke to Chaplain Betty Clark and Chaplain Maggie Foote. Let's hear what they had to say.
Right now we have 4 permanent chaplains and 1 services as needed chaplain, 2 at Highland Hospital, 1 at Alameda Hospital, and 1 in San Leandro Hospital.
We have expanded, of course, the San Leandro and Alameda, but we're also expanding to the nursing homes in our areas.
When you are experiencing an illness or an injury, anything that would bring you to a hospital or a skilled nursing facility or a rehab, we know that just doesn't just impact your body and your physical well-being, but also your emotional health and your spiritual well-being.
And the most common misconception about the role of chaplains is that we come in religion and that we come just to pray. So if the person is not religious, then they'll say they don't want a chaplain. And that's not the case. Sometimes the biggest support we give is to the family.
Things people are dealing with are about making meaning, and you don't have to be a religious person to look for meaning in life and try to make meaning of your experiences. And so we focus on accompanying people, whoever they are and wherever they are. It's for anyone who's kind of open to having a witness and someone to walk alongside them as they're navigating, whatever it is that brings them into the health system.
I always ask, what lifts your spirit? It might be the sun, the moon, the beach, and this one patient said a Harley. And I said, and every time I'd go in and do that, he'd laugh. And laughter is healing, helps lift your spirit. So that's what we do, whatever the patient needs.
Our role on the care team is to help keep the focus on the person as a whole and not just on a list of symptoms or illnesses that they have, and to help remind all of us that this is a whole person in front of us and they have things going on emotionally, spiritually that need attention, and that is part of their overall health and well-being.
Now, as you just heard, chaplains are vital members of the healthcare team. They actively contribute in bioethics and other hospital committees, participate in interdisciplinary rounds and family conferences, and they support staff with a safe space for reflection and for renewal. Their presence ensures that our care is truly holistic, honoring not just the body, but also the mind and the spirit. I'm really proud to say that on many occasions, I've been guided in my decision-making by the invaluable input from our chaplaincy staff, and I'm a better leader because of their guidance. At the Alameda Health System, we're proud to provide genuine care because we are real people, real care. Not just healthcare, people care.